Hello everyone. My name is Heli Majeethia, and before we get started, I wanted to quickly introduce my idea of Panacea. Panacea is a portable, quick, saliva-based sensing system for female hormones. Our users breathe into a mouth device, which analyzes the sample on the spot and outputs easily understandable data onto a smartphone app. We focus on reaching rural areas where women's healthcare and traditional laboratory techniques are difficult to access. A little bit about me. I'm a medical student at Temple Med now, and back in undergrad, I was a global public health major with a minor in bioethics. Because of my academic interests and life experiences, I have a passion for proactive preventive healthcare, and I like to find solutions that create sustainable, equitable systems or programs that can benefit the people who need them the most. I grew up having to do hormonal tests regularly. And let me tell you, the travel time to the doctors, the waiting, the blood draws, skipping school, and not yet finding answers was so frustrating. I then learned how much worse it is for women who don't even have access to some of these systems. And that is the context within which I created the solution. So why rural areas? What is the problem here? Based on my research, women in rural counties have disproportionately higher fertility issues than those in urban counties. They seek less help. This tells me rural women face barriers to seeking help. Only 6% of OBGYNs work in rural areas, while 20% of the US population lives in them. As a result, only less than half of rural women live within a 30-minute drive of the nearest hospital offering obstetric services. And over 10% live more than 100 miles away. This is a tough pill to swallow and leads to the conclusion that there's a real need for a portable hormone sensing system that can be used to track ovulation at home. So we define our target population as women living in areas with little access to fertility services who are having trouble conceiving and need to track ovulation through hormone testing. Now, how do we measure these hormones, you ask? There are multiple ways through saliva, blood serum, urine, blood spot test, but the method of interest to us is saliva. It is the most simple, the most non-invasive, just as accurate, and can be done multiple times a day to track hormones in real time. Here's an example of how estrogen, luteinizing hormone, and progesterone fluctuate during one menstrual cycle of 28 days. Certain combination of these indicates the ovulatory period, and so these are the three hormones we will be measuring through saliva. So hardware. The ELISA assay has been the gold standard of biomolecular detection and would be the sample analyzing system we would build into this breathalyzer type mouthpiece, which users would exhale into until a sufficient amount of sample has been collected. The assay would then detect levels of hormones on the spot and provide digital results onto a smartphone app. As for the software, the data gathered by the system will be pushed straight to an app and potentially to the user's medical team. Moving to our competitors. Our direct competitors are a blood draw and saliva test shown on the left that can be done at the doctor's office or at home. But their main drawback is that they have delayed results as you need to wait for the reports to come back. This does not allow for real-time monitoring of hormones, and women may miss their fertile window in the process. There's a DAISY device that's on the right that predicts one cycle based on basal body temperature changes. It is non-invasive and real-time, but not very accurate as it does not sample hormones, and body temperature can be confounded by various other factors. Indirect competitors are manual subjective entries into an app or a journal about cycles and trends, and they're prone to bias and incomplete data, as you can imagine. So how would we know that the product is helping as intended? We would track health outcomes and expenses for rural women seeking fertility services. Health outcomes are based on a variety of social determinants of health, and providing a more convenient, quick, portable way for women to do essential fertility tests can likely improve them. This would be measured through surveys and census. So who's going to be paying for this device? First up, consumers who wish to track their hormonal levels at home can purchase this product outright. Secondly, insurance companies in some states cover fertility services. Panacea could also help reduce the number of lab orders for hormone testing, reducing the strain on already overworked rural hospitals. So they may have a vested interest in providing this option to patients. Lastly, there are federal programs like the NARHC that have budgets for cost-effective healthcare in rural underserved areas. Lastly, potential challenges and unknowns are one, funding from investors to even build, prototype, and test the product. Secondly, we would have to find a way to account for variability in saliva sampling due to pH levels in the mouth, the effects of teeth brushing, food intake, and things like that to make sure the product provides accurate results in any setting. So thank you all for your time and attention. I hope you enjoyed listening as much as I love talking about this idea.